This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D or Odyssey.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch.
8:03. And if your clock doesn't say that, you messed up, okay? You can fix it, all right? Good morning and welcome to another edition of Health Watch. Every Sunday we're here, 8 until 9, here on Talk Radio 1210, WPHT. I'm your host, John DeMasi, with the one and only Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. What do we talk about here on the show? We talk about the who, what, when, where, why, and how of Innovative Medical Associates, how they can help you, and how they can improve your overall quality of life potentially. And that's what we do here on the show. If you have a question for Dr. Molly or a medical challenge, 855-839-1210. That's the number here in the studio, 855-839-1210. And we know that Dr. Molly changed her clocks.
Oh, John,
you're very thorough.
Hey, John, I'm not sure about the clocks at the office yet, but they will be before we get the onslaught of patients, definitely. Hey, you look rested, John.
Yeah, well, I tried to catch up on sleep.
Amen.
So that's one thing. But let's start with Innovative Medical Associates. Who you are, what you do, why you do it. Can you tell us that?
Sure. John, we are a bunch of like-minded medical professionals or healthcare professionals who really think alike. And they work out of the primary care facility that's in my office in Marlton. So we're able to do anything that normal primary care can do. If you need an x-ray, we can send you to radiology. If you need a prescription, we can give you a prescription. If you need laboratory work, we can do it right in our facility and send it out. So we're pretty much a primary care facility in theory. But it is how we approach our patients that changes. We want to use the least amount of pharmaceutical on that prescription possible to effectuate the change medically and keep the patient safe. Remember, all the physicians and healthcare providers take the oath, do no harm, that we can to effectuate their change and to do it with natural substances.
You know, many times, and we're going to tell the story later on, many times people come to you and they say, the doctor said there's no hope for me. And you kind of turn it around. Can you talk about that and what you do?
I think one of the things that I believe in first of all, with the great physician, and when I say the great physician, I'm talking about our Creator, we have to look that hope springs eternal. There is always hope. It may not look the way you think it will, but there's hope there. And our whole philosophy is to improve your quality of life. There's a new data out that says, if you can live long, but you live with all these debilitating diseases and you got all kinds of problems, guess what? That's what we want to avoid. What we would like to avoid is that you live long, and as they used to say in Star Trek, prosper. But we're talking about prosper in the way of your health. And that, to me, is a win. In other words, we're not curing people, but what we can do is aid people in their healthy journey, whether that is cancer, autoimmune, rheumatology, looking at, orthopedics, this kind of thing. How do we help them? Well, we help them using hydration, medical hydration, not to be confused with spa-like hydration. But, when I look at a patient, when they come in and we're working with my physicians, I can tell you that I hate it when they say, the doctor says there's no hope. I don't believe that. As long as our Creator's around, there's always hope.
That's an interesting aspect of your practice, in that you believe there's always something, and you have found many solutions to many problems with patients.
Well, we've tried, again, to improve quality of life. We like to meet a patient where they are in their particular continuum of care. Now, that means we may have to look at sending them out to specialists. We may have to look at doing additional radiology. And again, that goes to the primary care. They may need a prescription. The idea is, what can we do to improve their quality of life while they're going through a particular conditional journey? And I like to look at this as this is how you change people's lives.
You're a big believer in medical hydration.
Yes.
And you use that with
just about
everybody.
Just about everybody, assuming they're okay to take the hydration.
Yes. What are some of the ingredients that you use? I know you're going to talk about one later on, but just in general, what do you use?
We use vitamins, minerals, amino acids. We use peptides. It's too numerous to count. It's how we use them that I think makes the difference. We've been doing this, I think Linda told me 28 years. I can't even think back that far, okay? I guess it's about 28 years. And I was lucky enough to start this, of course, from my own healing journey. I came from traditional bench chemistry. I am a clinical chemist, I like to say, by trade. So I look at everything, where's the science? Where's the science? There's a lot of holistic type practitioners out there, and they have a place. I mean, I'm all for mindfulness, because if we switch up how you're thinking, we can switch outcome. I believe in that, but I believe that there are biochemical pathways that are always involved in someone's particular challenge. And that's where I decided to put my focus. And medical hydration was a great way to deliver the natural substances that are God's ingredients that have real scientific backup to show they can effectuate the change. It's usually the constituent in a particular natural substance that does the trick.
And I know you've been talking for forever about the synergy
of these
particular nutraceuticals,
of course, and how to use them.
Your protocols are your protocols.
Right.
You're the only one that has them, and there's a lot. There's a lot of them.
Yeah, and I will tell you, there's been very good protocols developed out there by many fine scientists and physicians over the years. I mean, this kind of business has evolved. But I would tell you that we spent a whole lot of time. I was lucky enough to be with an anesthesiologist, and I'm lucky enough to be with one now, actually, to say, okay, let's look at the synergies of the constituents in things and how we put them together. And I tell you, I am forever in awe of just how effective these things can be for patients. I am not saying we cure a thing, but I'll tell you what, we can improve your quality of life so much that I have people telling me, I never felt so bad, and these are people who are at stage 4 cancer.
And you have many of those.
Oh, I have too numerous to count.
Talk about, I know everybody's different.
Yes.
But on average, what can people expect when they start, and how long are they going with you?
Well, here's the deal. Obviously, it matters when you start. If you're coming in and you're at stage 4 cancer, come on. We've got a lot of ground to catch up on in order to help you feel a little better and help you continue possibly in a traditional continuum of cancer care, i.e. whether that is radiation or chemotherapy or some kind of combined therapy, immunotherapies, whatever. The point is, it takes a little time to do that. But I can tell you, actually, from the beginning of when someone starts, in the first 2 weeks, they start to feel a little better. And then gradually it gets longer and longer. You're in between this feeling of, abundance, and meaning I'm talking about health abundance, and also this feeling of being back on in your body.
Some people stop and then they'll call you, 2 months later, 3 months later.
Yeah.
Dr. Molly, I should have continued that. You want to talk about that?
Sure.
Sure.
I tell people all the time, look, this isn't holy water. I'm not going to say it is. It's entrenched in the science. We have to continue to keep the reserve up. And people say, well, why isn't my reserve up? Well, where do you want me to start? Look around. Have you seen how our air is polluted? Have we seen how mold is prevalent, particularly here in New Jersey and Pennsylvania? Have we seen how Lyme disease has become much more prevalent? So, I like to talk about the 7 plagues. I said, we got them all around here. And don't you think that definitely interferes with your reserve, because the body is always in a state to continue to fight off these challenges so that you can go back to homeostasis, which is the balance.
You have to keep up the reserve, and how do you do that?
You got to come in and, go on a maintenance plan. You can be once a month. It could be once every 6 weeks. You'll know. John, you were on vacation for, 2 weeks or something, right?
Like that,
and you said at the end of the 2 weeks, you knew you really needed to get in.
Yeah.
But you have several challenges. You don't have just one. Maybe some other guy could go on vacation for 2 weeks and still not see me for another 3 weeks.
Yes.
And that's happened.
Yes.
And that's great. I want that. But when I see people who have multitude or many facets of conditions and bona fide conditions, whether it's cancer and chronic conditions like diabetes and these types of things, guess what? You're going to be in the chair a little more often.
I had the trifecta, so
I know you did. But I thank God you had the trifecta. But look at you. I mean, with all due respect, just some of the metabolic issues that you've had in the past. You would be I believe in my heart, you would be much more impaired. And I'm not saying that this was a miracle, because I only want to believe in miracles is the guy upstairs. But I will tell you that I think we've managed to keep you going in a way that has made you a believer in this because you're living it.
That's right.
And that's what happens to most of my people.
That's right. We are coming up on our first break of the morning. The show is Health Watch. Every Sunday, 8 till 9 here on Talk Radio 1210, WPHT. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. The number here in the studio, 855-839-1210. That's 855-839-1210. If you have a question or a medical challenge you want to run by Dr. Molly, feel free to call. And we always tell you right at this point of the show, you call early and you can be sure that we have plenty of time to take your call, and Dr. Molly can potentially help you with your problem. 855-839-1210. That's the number. Dr. Molly and I return with more of today's Health Watch after these words. We are back here on Health Watch, and as always, operators are standing by at Innovative Medical Associates. And if you would like to call them and set up that initial consultation with Dr. Molly, it is complimentary. All you do is call right now, 856-489-0505. That's 856-489-0505. The initial consultation, as I said, is complimentary. All you have to do is call and set it up. It's very, very simple. 856-489-0505. And the website, InnovativeMedicalAssociates.com. InnovativeMedicalAssociates.com is the website. Our show is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210, WPHT. And the number here in the studio, 855-839-1210. If you have a question or a medical challenge for Dr. Molly, you want to run by her. The other day, it looked like you were having a meeting, and there was, it was a powwow, sort of.
In our conference room.
In your conference room. And I said, boy, this is intense.
It was very intense, John.
It was really, and it's an interesting story, and I know you wanted to tell it, so why don't you go ahead and...
Yeah, we're doing things a little differently than we usually do, but I think this story's worthwhile. You know, John, you walked in and you were regular. By the way, I was very busy, as you know, but I had set this up and I had sent this particular patient's chart up to my consulting oncologist in New York. And I really wanted to be in this meeting because I'm encouraging my patient to go up there and get some treatments with him, meaning traditional type of chemo, just given in a different way. And this story starts about 2 weeks ago. This patient, Melanie, and her fiance, Jim come in to see me. And they were on a quest to look at integrative or alternative treatments to help her with her cancer journey. That's the short story. They had gone to several other places, and they actually were going to a very well-known nutritional medicine person, and they came in with several bagfuls of nutritional supplements, and I mean several. Like, she was taking over 25 a day, and she just couldn't take it anymore. And in listening to their story, and looking over, more importantly, the data that was included in her medical charts, she was on a stage 4 breast cancer journey that started in 2000, I believe, and 17. Now, don't hold me to that exact date, but it was somewhere around there, so it's quite a while ago, right? But the cancer had subsequently moved to both the liver and the bone. And it's interesting because she got the diagnosis of it, I believe, in 2017, but it was a stage 1. They didn't want to do anything. She didn't want to do anything. And they put her on an oral, and it seemed to hold her. And she never went back. So she started to have pain in the liver, pain on the bone, this kind of thing, went back. And now she found out she's a stage 4, probably plus, if there is such a thing, with this particular cancer. In doing so, she looked erect. She was emaciated, dehydrated, everything. So I put her in the chair, and I said, look, I don't mind. You can go anywhere you want. You can do all these other alternative things, whether it's mindfulness, whether it's ozone, whatever. Right now, I believe you need some good old-fashioned hydration, nutrition with vitamin C, some amino acids like glutathione, blah, blah, blah. All the time I'm encouraging her to go back and look at traditional treatment because this is bad. In the meantime, they had scheduled a vacation, John. Okay?
Geez.
So they came to me every day that first week they were here, which is only a couple weeks ago.
Yes.
And I got her in good enough shape to go on that airplane. But I said to her fiance, listen, I don't think this is a great idea, but it's something she wants to do. And if it is something she wants to do, she ought to do it now. Okay? And again, I'm a big believer in hope. So they go down to, I don't know where in Florida, but they're in Florida. And I get a panic call from the fiance. And he's telling me what's going on. And she's worse than ever. And the pain is back. Now, they had missed several days from the clinic, obviously, because they're there. And they had flown. Can you imagine being in the recirculating air and all that? Okay. Yeah. They had flown. So I talked them off the ledge and said, get her to the hospital. He gets to the hospital, calls me 2 hours later, and he says, they want to do chemotherapy. I said, for the love of God, pray on it and do it. Do it. Can you talk to her? Yes. I get on the phone. I say, Melanie, you got to do it. You need to get some stability here so that you can come back and then continue your journey about alternatives. And now I'm coercing her, right? Whatever. So they go in, they deliver the chemotherapeutic by IV. It's usually given for cancer. I don't know if her tumor receptors at that time were receptive or it was a drug that, she had never had before. I'm not really sure about all of that. But they got stable. They stayed there for another few days. And lo and behold, they're back in my clinic on, I guess it was, when did you come? Thursday. That was their first day back because they just came back. So I said, what are you thinking? She said, I'm thinking about doing some more alternative treatments. I said, I'm thinking about setting up a consult with my consulting oncologist, and I think you need to hear from him, and let's see if we can do something alternative within the framework of traditional.
And you've always said that. You
Yes.
believe in if you need the surgery, you get it.
Right.
Or whatever you need, you get it.
And she had the surgery way back in 17. That was gone, right? But here we are. So I set this meeting up, and we go through this entire process. And at, midway through the thing, the consultant says to me, now, Dr. Molly, and he asked me about everything I'm giving her, and he's giving me an okay, and he put in something else. And he said, but why do you want to send them to me? I mean, it seems like she did well, quote unquote, on the drug. And I said, you know why? I said, let me tell you why, Doc. Because the system told her the next step for her was palliative care. They were not going to give her that drug because they decided that her particular count was too low. Although by the time I got to her and tuned her up a little bit, the count had come up a bit, but they still weren't going to do it. The oncologist said, that's it. Your next step is palliative care. Well, guess what? He said, when can they come up? And I said, this is why I love you. I said, you know, there's a patron saint of hopelessness. I don't know. Is that saint elsewhere or something? I remember. I don't know. Please don't hold me to that, any of you guys out there who are biblical scholars. But I feel sometimes that my consultant, is just a great guy, and he and I believe in hopeless cases. So the long and short of this is she came in Thursday, Friday, this week. I tuned her up pretty well. When I saw her Friday, she said, I'm feeling better. I said, oh, no. You're feeling better because we were able to give you a particular amino acid or peptide, as the case may be, that can actually help in this situation with the chemo that you had in the past and will help in a continuing way. I said, the idea is I'm going to work together with this oncologist and we're going to tune you up. And I said, Melanie, the bottom line is this is in God's hands as well as his hands, my consultant, and myself and everybody else. But it's in your hands too. We've got to do the right things, John.
You know, I'm listening to this story, and once again, somebody says, and this was a well-known institute in Philadelphia, who told her, palliative care. In other words, it's all over.
Right.
That's basically what they told her. They
can't do anything else. They can't. This is what the protocol calls for. You don't fit that mold. Therefore, you get nothing else. Well, you know, guys, I'm a Philly girl. I always believe there's another bus. Okay.
Right.
So. This is the thing, you know. You can't be cavalier. I don't subscribe to the school of thought that you get a diagnosis in 17, you keep taking whatever, and you say, oh, I'm fine. Can't put your head in the ground, John. You know that.
Yes.
You know that. I'm proactive. I want you to do everything conventionally that needs to be done to help keep that beast at bay, you know. But once we have this thing, it really is a case of keeping this beast under control. And I'm a believer that, you know, anything can happen. You need to stay on top of your own health. And that's what I was getting at. In other words, this case affected me so much, John, I can't tell you. You know, I spent 45 minutes or so in that consult because I want people to understand, I don't want to work harder than my patients. But sometimes I feel the need to go a little further. And it's just that we need to look and we shouldn't give up. Hope.
And this goes to show that there's always hope and there's always a way. And you have, this is a story that you've said many times.
Yes, but I would tell you this one really affected me because she's young. They're just starting out, you know, together in this portion of their life. And I just feel that, you know, I think that they sucked the rest of the life out of her when they told her this is it.
Oh, boy.
So here we are.
That's a story. This is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPH.D. We are at the halfway point of the show. And as I always say, time flies when you're having fun. But we have plenty more to talk about here on the show. We're going to be talking about peptides and glutathione and other things. 855-839-1210 is the number here in the studio, 855-839-1210. If you have a question for Dr. Molly or a medical challenge you want to run by her, that's the number here in the studio, 855-839-1210. It's Health Watch every Sunday, 8 till 9, here on Talk Radio 1210 WPHT. I'm your host, John DeMasi. Dr. Molly and I will return with more of today's Health Watch after these words.
Good.
We are back here on Health Watch, and as always, operators standing by at Innovative Medical Associates, and the number 856-489-0505. Again, 856 855-489-0505. And you say, well, I call and what do I do? Well, very simple. You make an appointment with Dr. Molly for the initial consultation. It is complimentary, and you really find out a lot about your condition and how she can potentially help you. And that's it. It's a good starting point. 856-489-0505. And the website, innovativemedicalassociates.com. A lot of good information on that as well. innovativemedicalassociates.com. That's the website. It is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. We are going to go to the phones right now. We'll talk to our buddy Frank in Northeast Philly. Frank, good morning.
Hey, Frank.
Welcome to Health Watch.
How are you?
Good morning, Dr. Molly and John. I have a nice comment, Dr. Molly, but first, the story you just said, it reminded me when I first came to see about 4 years ago.
Yes.
I'm in a chair, and a Catholic priest came in, and he said very loudly so people could hear him, Dr. Molly's place is his favorite place on earth. And there's a reason for that, because it is, I'd rather be at your place for 3 hours than, say, Game 7 of the Stanley Cup or World
come
Series.
on, Frank.
No, I'm serious. Where can you find, as you, Dr. Molly, I was in healthcare for a while as an aide, nurse's aide, LPN, RN. You get good people here and there. We never get a group of people at the same time every day together like your place is. It's wonderful.
Oh, you're very kind, Frank. You're very kind, Frank. Go ahead.
Dr. Molly, so are you. You're more humble than anything. You say you're biochemist, PH.D., clinical, not psychologist. What do you say?
Clinical chemist. Yeah, chemist, that's right.
But you downplay things. You're remarkable. You help so many thousands of people. But anyway, this is a spin on that. John reminds us every week or so, like people ask him, hey, that stuff you're getting, does that really work? Does that help you? What about this, Dr. Molly? Has anyone ever walked up to someone at a gas station and say, hey, I see you getting that gasoline once a week. Does that stuff really help your car?
That's right.
Or,
that's right.
That's right.
Or, I mean, does it make it run better? Or,
Yeah, that's
when
right.
you get oil, not
good one.
once a week, but every 3 months. Does that really help the car better?
That's right.
Well,
That's
the
right.
oil is low-dose naltrexone. The gasoline is
Right.
the proprietary formula.
Good
Yes,
man.
this stuff works. There's a reason she's been around for a long time, and people who are doctors leave their practice to go work for Dr. Molly because it helps people more than modern medicine can. So that's, again, gasoline helps the car, oil helps the car too. You help the people's body run and work better, Dr. Molly.
Thank you. Thank you so much, Frank.
Well said,
and,
Frank.
I really appreciate the accolades for my staff. They're great gals and guys. And I just pray to be doing this for a long time. And I just wish this was more in keeping. I think medical hydration as the delivery system, people have to understand it's truly a medical modality. It is not that we're doing something like, listen, everybody's going to come home from the parade, and if they need a little drunk situation to get back to work, I'm all for that. But that isn't what we do. That's not our focus. And we really focus in on these chronic conditions and people who are at a crossroads in their health care. So thank you, Frank. Thank you very much.
And Dr. Molly, when I was the last time I was at your place on Ash Wednesday, Valentine's Day, just want to say hi. The ones I talked to, Fran, Vicky, Lana, and Linda. Thank you, ladies.
You.
Have
God
a good
bless
one,
you.
Dr. Molly.
Thank
And
you,
don't
Frank.
be a stranger, Frank.
Thanks-
you know
thanks for
that
the
I
call,
told you
Frank.
I'd tune you up again. God bless.
Okay, thanks, Dr. Molly.
Right.
Thank you, Frank. Thanks for the
That
call.
was a nice call.
And then there was the time, a minute before we started the show,
Yeah.
where you said, I think we got to go to the hospital.
Oh, yeah.
Yeah.
Oh,
and,
yeah.
And,
Oh,
and
yeah.
we did. And
We
yeah.
did. That was the craziest day, wasn't it? Frank? That was
I
the
mean,
craziest day.
I mean, when
And
you say, look, let's play a tape.
I did. I actually spoke to Jim that day. I said, Jim, don't listen to him. Don't listen to John, my host. Today you listen to Dr. Molly, the guest. I want a tape. He went, okay. Oh, my God.
boy.
We've lived it,
Yes,
John.
we have.
know. Listen, we know each other a long time. And again, it's these chronic conditions that do us in. It's these chronic conditions. How many times can the body fight on various fronts? It's just like, it's a war. It's a war of good health. We
Yes.
want to have good
Yes.
health. And so talk about a little bit about peptides. We use peptides in our practice. We have been using peptides for quite a while. But, peptides are not this is not a mystery. People think, oh my God, there's all these new drugs out where are peptides. Peptides are short chain amino acids or proteins that have specific functions, and they work, actually. The reason why I love them so much is they induce specific types of response. Either they activate or inhibit certain cellular pathways. I always talk about this is the biochemist in me. So here they react by interacting on your surface of your cells, the receptors. And in doing so, they can show improvement in a lot of areas. Right now, the whole world is talking about these peptides for weight loss, right?
Yes.
It's a big mystery,
Oh,
right?
yeah.
We've been using these for years, and they're natural. They're God-given. The question is, you got to use them right. And all the negative that you're seeing right now is because people are overusing them. They're using them to lose 5 to 10 pounds, 15. No, these are for people who are truly obese, who need to have a little push in that area. And then you've got to go into something called like mindful eating. So here's a two-pronged approach. You can't just say, okay, this is going to cut your appetite. This is going to, help with the insulin use. But you also got to help the patient rethink how they eat. I mean, you got to. Bottom line. And that's something we do in our clinic. And we also use cofactors that I deliver through the medical hydration to enhance the action of the peptides. So that's just one thing we do. But we also know that peptides can promote healing and repair, so we can use that with our PRP, our regenerative medicine that I use quite a bit with. I've used it for patients who have chronic fatigue because it helps with energy metabolism, right? And it can really fine-tune that system. So what will it do? It will help patients have less fatigue through their condition. Not alone. I might have to use what? Vitamin C with it. I might have to use methylated Bs with it. So there are cofactors that actually become cofactors to the peptides, and the peptides can become cofactors to other things. So it's an interesting thing. How about hormone replacement? And the biggie, everybody knows that all the muscle-bound have used peptides for years, right? Over the counter, getting them in from Mexico, all the stuff that you don't need to do, because you can go to a medical clinic and get what you need and deliver them in a safe and way that is really specific for your particular challenge. So peptides have a lot of good. Okay, and let's look at one of the biggies too, collagen. Collagen is a peptide. Did you know that? No. Everybody comes to my place like there's some mystique about collagen. It's not a mystique. It's been around. It's been around since God created us. Okay, so collagen is one of the peptides. Very good for the skin. We all know that. And be lucky enough to work with Dr. Glass. Who doesn't know that collagen is very important for new skin and,
yes.
Using it naturally, using it for some of my skincare products. But again, I want people to understand that peptides have the ability to inhibit or also activate. So what does that go back to? My Goldilocks theory. You don't use too much. You don't use too little of anything. Just enough. In addition, I want to talk about the biggie, one of the biggies in peptides. That's glutathione.
And that's where I'll stop you, because we have to come up on a break.
Okay.
That's our last break of the morning.
Okay.
And then we're going to talk about glutathione.
Okay.
You'll have plenty of time.
Thank you. God
It's
bless
Health
you.
Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHD. I'm your host, John DeMasi, with Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. 855-839-1210 is the number here in the studio, 855-839-1210. We still have time to take a couple of your calls if you have a medical challenge or something you want to run by Dr. Molly. 855-839-1210. We're coming back with more of today's Health Watch after these words. Back here on Health Watch. Again, operators standing by, and they will be there well after we leave you at 9 o'clock. So if you call now, great. You can call after 9. 856-489-0505. You can call during the week, but make sure that you make the call and set up that initial consultation with Dr. Molly. 856-489-0505. And the website, innovativemedicalassociates.com. innovativemedicalassociates.com. That's the website. It is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. You want to talk to Dr. Molly? Got a few minutes left of the show. 855-839-1210 is the number here in the studio. We're going to talk about, we started to talk about it, but now we're going to talk about it.
So,
glutathione.
Glutathione. I love glutathione. It's a peptide that's consisting of 3 key amino acids. That's why many times it's just talked about in general as an antioxidant or whatever. But I want people to understand that glutathione is so crucial to health that every cell in our body produces it. Get that. Every cell in our body produces it. So it's the body's most important antioxidant because it's within the cell. So although it's absolutely essential to maintaining a healthy immune system, it's not necessarily considered or technically considered a essential nutrient because the body can create it from certain other amino acids. By the way, which we use all of those as well. But one of the things that blew me away is that I read an article that went back to 2004, a study published in Cell Biochemistry and Functional Highlights said elevated levels of glutathione in tumor cells, now this is in the lab, right, were able to protect such cells in the bone marrow, the breast, the colon, the larynx, and in lung cancers. Now, that is profound. Now, there also was a study that said the reverse is true. Glutathione deficiency causes cells to become more vulnerable to oxidative stress. That's why it's considered an antioxidant, which contributes to cancer development. So, we know, too, that there was extensive research in glutathione for neurological diseases like Parkinson's, and we use it in our Parkinson's protocol. So, again, the idea is you want to look at glutathione extracts, okay, and things that can help promote glutathione within the body, like extracts of milk thistle, which has a constituent that is very, very unique. It's a flavonoid that can help your own glutathione and boost the levels. And if we put some more in, we're able to boost the levels that we think will help our patient through a cancer situation, that kind of thing. The other thing is there's a lot of naysayers that are doing chemotherapy, and they believe that glutathione would really not help a patient, okay, during chemotherapy. And sometimes they tell them that you shouldn't use glutathione. But I have seen as many results using glutathione with the certain cancers, particularly the lung cancers and the breast cancers. I've seen lots of data to support the use of glutathione. So again, it comes down to a judgment call about your medical professional. And that's why it's important for my physicians to really look at people's charts, and we sit down and we talk about this. We know glutathione definitely can help people with toxicity in the liver, whether it's from alcoholism or also from certain exposures. You really want some glutathione. The other thing, in the mid-90s, they found that certain people in the hospitals, in particular people who had AIDS and those kinds of serious kinds of life-threatening diseases, invariably were depleted in glutathione. The reasons weren't quite understood then, and they still aren't. I mean, I think this is one of God's miracles. All I know is glutathione, looking at it as the peptide and the communication that it does and the antioxidant level is extremely important for maintaining intercellular health.
Let me see if I can get this straight.
It's hard.
Okay. Compare glutathione to vitamin C.
Okay.
What's
happily.
the difference?
Glutathione helps raise glutathione in the red blood cells and the lymphocytes. Okay? So it helps work with glutathione to prevent oxidative stress. So what I would say is it helps protect the glutathione-dependent enzymes, and that's part of the communication data. So, yeah, you'll see that I use glutathione with vitamin C and also with vitamin E. So there are many ways. The idea is you have to understand the framework of how and when to use it and what's appropriate. And I would say I've never seen anybody who've overdosed on glutathione, but there is some data to say it may do that. But I got to tell you, it seems to me that the body knows that methylated ingredients are the most critical step in keeping the body producing its own glutathione. And at some point, we'll talk about the methylated vitamins, and you know that, John.
Yes. What percentage, though, of cases do you use glutathione? Would you say many of them?
Many of the autoimmune, many of the chronic fatigues, those kinds of cases. Toxicities, whether it's environmental medicine cases, and we're seeing particularly one of my patients from out of town, very important because of the liver involvement, using it with our cancer patients. You name it, I think glutathione is an all-around agent. It depends on how much, what you use it with, and how to use it, in what regard. For example, also the neurodegenerative diseases, we like to push glutathione in. So there are many ways to use it.
And you're the scientist, so you know how to use it.
Well, we try. Well, I'm lucky enough to have wonderful physicians who help me utilize the glutathione protocols. You know, John, it's great.
Yes. And with that, we're going to put the wraps on another edition of Health Watch. Don't forget, if you want to talk to Dr. Molly, set up that initial consultation. Operators are standing by at Innovative Medical Associates, and they will be there well after we leave you at 9 o'clock this morning. In fact, they'll be there all day. They're not taking off. 856-489-0505 is the number, 856-489-0505. And don't forget the website, innovativemedicalassociates.com. innovativemedicalassociates.com is the website. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, and our nursing staff, Barbara, Lana, Donna, Vicky, and Daniel. And then there's Joanne, Delightful D, Fabulous Fran, and our medical assistant, Sandra. I'm your host, John DeMasi. Thanks for listening. We'll do it all over again next Sunday, Health Watch, 8 till 9, here on Talk Radio 1210 WPHT. You take care.
This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.